Good evening, everybody, and welcome to our Tech Tuesday, and welcome to anybody who's going to be watching this recording later. We're glad that you could join us and watch this tonight. I found this very interesting article recently going through some of my old books, and while it was a relatively old book and the information may have been relatively old, through a little bit of cross-referencing, it doesn't look like there's been too many updates, surprisingly enough. And I mean, the book was written a good few years ago, and the article that I've taken is a good few years old, but the information that is still being given out medically is still very much the same as it always has been, unfortunately. But I found the information from this particular article very, very helpful, and even I learned a few things, even though I've been in orthopedics for quite a while. So let me share my screen. And hide all these other bits and pieces. Hide me. So we are talking about a little thing called osteoporosis. And the title of the book that I've taken this from was written by Professor Willem Safontein. And he calls it Medical Misconceptions Exposed. And the title is, Did Your Doctor Tell You? Now, I am going to put in a little bit of a disclaimer because this is going to be a recording that hopefully is going to help a lot of people and go around quite a few different places. And this series is a summary of information that I gleaned primarily from a book written by Professor Willem Safontein. Prof. Safontein was a professor in the Department of Chemical Pathology, University of Pretoria. He was an expert in medical science and the healing power of nutrition. The statements made here are for information only and should not be considered medical diagnosis or prescription. Before you embark on any diet, supplementation program, or lifestyle change, or before you change any medication or treatment regime, it is advisable to discuss the matter with a practitioner who specializes in that particular field of healthcare. Please don't just randomly go off and do your own thing. It is not a good idea. So we're going to talk specifically about osteoporosis. And what every good doctor will tell you is if you have osteoporosis, you need to take calcium. But is calcium the only answer? Osteoporosis is an extremely common condition, but many appear to know very little about it. As I said, the information that I'm picking up doesn't seem to have changed much from many, many years ago. Osteoporosis is nearly always a companion of old age, but not necessarily. Not only is it debilitating, but in many cases, life-threatening too. How many times have you heard about an elderly person, and we're talking 70s, 80s, who fall, break a hip, they go through the surgery, have the hip repaired or replaced or whatever, and a couple of weeks or a couple of months later, they suddenly pass away. So this is where it can become life-threatening. The condition does far more than cause bone fragility and occasional aches and pains. Most people will complain about aching and painful joints when they get above a certain age. And I often say I've seen young people of 96 and I've seen old people of 26. And me personally, I get a little bit upset, I suppose, or excited, I suppose would be another term, when people in their late 30s, early 40s complain about being old, because they're not old. They just feel old, but they're not actually old. Pardon me. The overall lifetime risk of a woman suffering from a fracture is 40%, more than the combined risk of getting breast, ovarian, and endometrial cancer. So you probably, or you will, have a greater chance of breaking a bone as you age than you will of getting any of these other dread diseases. Sadly, there are numerous myths around the assumption that you can do nothing about the condition. And to prevent it, you need only to take estrogen and calcium supplements and drink a lot of milk. That's the standard information given out. Now, such advice is not only wrong, but it achieves nothing by preventing the disease. And it may also be harmful in the long run. The truth, in general, calcium supplements should never be taken alone, but always in combination with magnesium and other minerals, which are usually more important than the calcium on its own. So, osteoporosis, basically, as I often tell my patients, if you had to cut through healthy bone, which is, if you can see my cursor, but this little bone here on the left-hand side, it should look like the inside of a crunchy chocolate. You know, the chocolates that have got their little golden honeycomb on the inside. If you cut through osteoporotic or weakened bone, it's going to look like the inside of an Aero chocolate. And the weaker the bone, the bigger the bubbles. You don't really want a lot of bubbles in your bones. Now, there's a certain amount of bone loss that happens naturally as we age, and this is called type 1 osteoporosis. And this is due to declining hormone levels, lack of exercise, and general poor nutrition. It is typically caused by loss of trabecular bone or the porous material in the inner bone. So you can get the outer layer over here, and then all these little dotty bits in the middle is your porous material, and that's called your trabecular bone. Normal bone loss for women is about 10% of total bone mass per decade, from around the age of 25 to 30 years. Men lose about 6% per decade. And part of the reason why women lose more bone mass is, most specifically, when they have babies. That little baby is a little sucker. And they've got a developing skeleton, and they need calcium and other minerals to develop their skeleton. And if mom is not supplying it via her diet, they're going to take it from mom's bank, which happens to be her bones. And that is why women generally lose more bone mass than men. By the age of 80, women have generally lost about 50% of their bone mass, which is why little old ladies are generally lighter. Bone loss increases in postmenopausal years, about 4 to 5% per year during menopause, and a number of years after. So, sorry, bad news is you're on a losing streak from about the age of 25 onwards. When this happens, there is an increased risk of fractures, mainly vertebral, distal forearm, and ankle. And these are all your weak spots, your crumple zones, as I often refer to it. Secondary osteoporosis occurs later in life and is associated with a loss of cortical or outer shell. This part over here, if you can see my cursor, around the outside over here, which is as well as the trabecular bone, and frequently results in hip fractures. So essentially, if this outer layer wears away and the interlayer or inner layer has become looking very much like an Aero chocolate, your risk of having a fracture becomes a whole lot greater. And while I can't pinpoint and say specifically, my theory is that when I see little old ladies in casualty or in hospital, and I ask them, well, what happened to you? And quite often the story varies from time to time, but in a lot of cases, the story is very similar. Oh, we were out for a walk and I tripped over something and I fell and I broke my hip. Or the other common one, I was out in the garden and I was in my rose garden and I must have stood on a stick because I heard this, and the next minute I tripped over the stick and I fell and I broke my hip. Where my theory is that when they stumbled, that was because the neck or femur, that's this little part over here, has broken. So in fact, their leg broke before they fell. Now, I can't prove that, but my theory tells me that is the sequence. Rather than people falling and breaking their hip, they break their hip and then fall. Different lifestyle and personal factors may accelerate the process of this bone loss as well. And these things include, among others, family history of osteoporosis. Unfortunately, you can't change your genes. Hormonal deficiencies. Again, you don't have too much control over that. Drugs, such as corticosteroids, that you do have a little bit of control over. Smoking, you have full control over that. Lack of exercise and mineral deficiencies, which to a greater or lesser extent you have control over as well. Simply because that relates to diet and movement. Osteoporotic fractures should be avoided at all costs due to their long-term consequences. Osteoporotic fractures shatter and splinter, so the healing process is retarded and complicated. And if you think about taking a nice tiny teacup and you drop it from about waist height onto a nice hard tile floor, guess what your teacup looks like? Now, compare that to a solid wooden stick that you drop from the same height onto the same tiles and see what happens. And that is pretty much the difference between an osteoporotic bone and a healthy bone. The stick is probably going to bounce. Unless it gets caught in a hole and then bent sharply, it's probably going to bounce and have no problems. It might have a little bit of a ding, but your cup is going to be in about 1 million pieces. And that is what happens to your bones if you have osteoporosis. They shatter. Most people do not die from osteoporosis, but rather the complications of it. And I don't really have time to get into all those complications, but there are numerous of them. Less than 50% of osteoporotic fractures will allow people to return to their previous level of functioning. Not that they won't be able to walk. In most cases, they can get up and walk. Yeah, you've broken your hip, you have a hip replacement, and we generally try and kick you out of bed and drag you around the block within a day or so of the surgery. But when we talk about this previous level of functioning, you quite possibly find that before the person fell, they were quite sprightly and walked around without the aid of a cane or a walker or anything like that, and they were very comfortable. After they fell, they can't walk without at least a walking stick, usually crutches or a walking frame of some sort. Pardon me. And they don't walk nearly at the same pace, and they suffer with a lot more pain and discomfort. So what does bone look like? What is its composition? How is it made? How is it created? Bone consists of a protein matrix, which makes up about 20% of it, onto which minerals are deposited during bone building. Think back to the dark ages in your school chemistry classes. Some people will have gone through it, some people wouldn't have, but one of the things that I remember from school is that one of the science experiments that one did was you learned to grow crystals. And you took a piece of cotton or string and you dipped it into a certain mix of chemicals, and you had these little crystals form on there. Now, think of your bone doing the same thing. It's a little stick with a whole lot of minerals that are deposited around there to build it up. These minerals are mainly calcium, magnesium, zinc, and a number of microminerals, each of which has a specific function in the formation and maintenance of bone. The matrix consists of type T collagen and small quantities of non-collagenous and glycoproteins, each of which serves a specific purpose. I know I'm getting a little bit technical over here, but don't worry about these big words. Most people will have heard about minerals. Most people have heard about collagen. And hopefully I can put a little bit of into the myth about collagen over here as well. Now, collagen is the body's main structural protein, while glycoproteins are proteins linked to sugar molecules. Glyco meaning glucose, meaning sugar. The non-collagenous proteins consist mainly of the protein osteocalcin and the mineral transporting protein osteronectin. Apologies for the big words, even they trip even me up at times. Now, where does calcium come in to bone building? Calcium certainly is an important bone mineral, but it is not the only mineral. Generations of doctors have taught that calcium supplementation and drinking milk are ways to prevent osteoporosis. Milk really is a good source of calcium, but it is not a good source for building bone because it lacks other vital minerals such as magnesium. So you win some, you lose some. The milk advice was given solely on the basis that calcium, quantity-wise, is the principal bone mineral. And this started way back when medical science wasn't as developed as it is now. And this does not mean that giving calcium in isolation or drinking milk will promote bone formation. There is evidence to show that bone loss is accelerated if calcium intake is less than 500 milligrams daily. An average balanced diet will give you around 800 milligrams of calcium. And when we talk about balanced, we're talking about dairy, not just milk, but yogurt, cheese, etc., as well as calcium-bearing vegetables. There is less evidence that increasing calcium intake to above 800 milligrams on its own will effectively prevent or retard bone loss. So above 800 milligrams, probably not going to do much. Won't do much harm, but probably not going to do a lot of good either. Despite years of calcium supplementation, total incidence as well as age-specific incidence is sharply on the increase. I don't have the current stats at the moment, but some of the stats that I did pick up was in South Africa. 1 in 3 women and 1 in 5 men will possibly develop this disease within their lifetime, which means potentially between 4 and 6 million South Africans suffer from osteoporosis. Now, I can't see everybody that's on this call right now, but when I, in my meeting, in my slideshow, just have a look and see how many people are on this particular meeting. And look to your left and right, because 1 in 3, and when I went on and I hit everybody else, there were 4 of us. So 1 in 3 ladies are going to probably develop osteoporosis, and 1 in 5 men. Ironically, osteoporosis is more prevalent in the developed world where the intake of milk products is high. In many developing countries, the staple plant foods contain much more magnesium than calcium. And bone formation cannot take place in the absence of adequate quantities of magnesium of between 300 to 500 milligrams daily. There is no evidence that higher doses of calcium, more than 1,000 milligrams, taken over long periods can prevent osteoporosis. So you can take a ton of calcium, but your body's not going to be able to utilize it. Calcium is definitely a vital bone mineral. When supplements are needed, if your daily calcium intake is less than 500 milligrams, no more than 500 to 800 milligrams of elemental calcium should be taken in the correct absorbable form. And when we talk about elemental calcium, if you look at a calcium supplement, quite often it'll show you that there's 1,000 milligrams of calcium, but then if you look at the fine print, it'll tell you that there's only, say, 200 milligrams or less of elemental calcium, meaning that of that 1,000 milligrams, you can only really use about 200 milligrams. So when we talk about elemental calcium, that is the amount, 500 to 800 milligrams of elemental calcium that you use. Doesn't make a difference about what the rest of the form says. Calcium glycinate is the best absorbable form of calcium. It's not the cheapest, but it is the best. And I'll go one further and say that it should also be in a chelated form. Now, chelation means that it is bonded with an amino acid. Our bodies are made up of amino acids and proteins, as I've already said. So when you eat or supplement with an amino acid, your body recognizes it. This is, oh, great, there's an amino, I can take you in. And I go, oh, hang on, got a little hitchhiker on here called calcium. Great, we'll use it too. If your supplement is not chelated and not glycinate, you probably are only going to absorb roughly about 10, if you're lucky, about 20%. The rest of it is going to go in and it's going to go out. Or worse, as I'll show you shortly, it's going to stay in your body, but not in the bones. Calcium oxide or carbonate is the worst form of supplementation, as it is not only poorly absorbed, but can also neutralize your stomach acid, which is vital for mineral metabolism. Now, most forms of calcium supplements that I have seen that have been prescribed medically are calcium carbonate. Carbonate is rock. It's chalk. Go down to your local stationer shop, buy a box of chalk. That is calcium carbonate. Chop that into tablet form, and that, unfortunately and sadly, is what most supplements are. Now, when I talk about supplements, again, a supplement is in conjunction to a balanced diet. It must not ever replace a good diet. You can never replace your calcium that you're getting from your diet with a supplement. It's there to build on and to boost. So we're now going to talk about the principle of synergism, meaning going together. Calcium is not a drug. It is an important nutrient, and nutrients never act in isolation. In nature, you will never find a single vitamin B, for instance. It will be in a B complex because there are 8 vitamin Bs. You will never find a single vitamin E. It is part of a chain of 8. So the same with minerals. Each mineral does not work on its own. It needs the trace minerals as well. Many clinical studies are done with single nutrients, and as such, yield information of little real value. So when they tell you that case studies have been done, check and see how those studies have been performed. The clinical response to any particular nutrient is largely dependent on the relative status of the individual or group with respect to the other synergistic nutrients for the particular nutrient tested. So they can test calcium, but what else was there? Was there magnesium? Was there other trace minerals? And they can only then, with all the other things, tell you how much calcium was absorbed. If it was just calcium on its own, you're never going to get a true reflection. Clinical researchers are often doctors with a sound training in pharmacology, but with little or no training in nutritional science, which is a completely different kettle of fish. Nutrients are therefore evaluated in much the same way as individual drugs. Not a good way of doing it. There should be no longer any doubt that calcium on its own cannot build a shred of bone, because bone consists of many minerals such as magnesium, silicon, fluoride, zinc, copper, boron, manganese, and phosphorus, each with a specific function. Now, just to put this into perspective, Prof. Serfontein, who wrote this particular section of the book, is or was a clinical nutrition researcher. So he was a professor, not a medical doctor. He was a nutrition researcher, and as such was able to dive a little bit deeper. In the process of bone building, these minerals and many other nutrients are needed. If any of these are in short supply, the process of bone formation will be retarded. Depending on the severity of the deficiency, this may lead to overall bone loss, despite the adequate intake of calcium. So you might be getting enough calcium, but if you don't have the other minerals, you're wasting your time and your money. Calcium retention is also critically influenced by magnesium status. Again, you can take a ton of supplements. If your body is not able to absorb them, what's going to happen? It's either going to go straight through, or worse, it's going to stay in your body and can lead to other complications. So magnesium, what is this other little thing called magnesium? Of all the factors that support the skeleton, the calcium-magnesium ratio is perhaps the most important and an excellent example of the interdependence of nutrients. When blood magnesium levels decline, the kidneys readjust the calcium-magnesium ratio by excreting more calcium and vice versa. Magnesium supplementation is one way of improving your calcium retention. And your best ratio is 2 parts of calcium to 1 part of magnesium. Supplementation with magnesium, even high levels, does not suppress calcium absorption, as is sometimes claimed. For preventing and possible reversing osteoporosis in practice, magnesium may be more important than calcium and is often more deficient in Western diets. In a 1994 study, it was confirmed that optimal bone formation cannot take place in the absence of magnesium, regardless of how much calcium is taken. So where does this whole distribution come in? Bone density is determined not only by the type and quantities of minerals absorbed, but also by the distribution and the ultimate fate of these nutrients in the body, meaning that they get taken in, whether in diet or in supplementation, and they circulate around your system. If they can't be absorbed, they just keep circulating. Magnesium and vitamins K and D are important determinants of mineral distribution. Magnesium has been shown to increase bone mineral density in men and women by increasing the retention of calcium in the bone. A large percentage of the body's calcium is present in the skeleton, and the rest is present in the blood and tissues, including your artery walls. And this is where the scary part comes in. Accumulation of excess calcium in the artery walls leads to a thing called arteriosclerosis, often in the middle layers of the arteries, where you can't see it. Arteriosclerosis in the middle layers of arteries is not immediately visible and has nothing to do with fats or cholesterol. And some doctors will tell you, you need to take calcium, but don't take too much because it can lead to arteriosclerosis. And this is why. Magnesium plays a pivotal role in the process of tissue calcification, and a prominent feature of magnesium deficiency is the deposition of calcium in certain tissues. Just got to watch the time because I know I am running out. Magnesium deficiency is extremely common in the developed world. Most osteoporosis patients have very low magnesium levels. So if you're osteoporotic, get yourself tested and see what your magnesium levels are like and supplement accordingly. Another thing is vitamin K. Vitamin K has attracted considerable attention as a regulator of bone and tissue calcification, as it keeps the calcium inside the bones and out of arteries. Vitamin K, in an enzymatic reaction, forms GLA, which is gamma-carboxyglutamic acid. Big word, don't stress about it, which is a derivative of the amino acid glutamic acid, one of 22 amino acids that our body needs. Calcium-carrying proteins are formed when GLA is incorporated in one or more of the amino acids in their chain, and these protein molecules are able to hold on to calcium, thus forming a special type of chelate. After grabbing a calcium ion, the complex can move around and enter bone structures where calcium can be deposited. Where a vitamin K deficiency is, the risk of bone fractures increases, and one study found a relationship between decreased bone density and low levels of vitamin K in men. Because remember, men are not immune to osteoporosis, as a lot of men unfortunately think. When taking anticoagulants like warfarin, vitamin K is suppressed in cells. Now, anticoagulants are blood thinners. If you've had orthopedic surgery, you are going to be put on blood surgery, on blood thinners. If you've had any major surgery for that matter, you're probably going to be put on blood thinners. Brussels sprouts, cauliflower, and lettuce are very good sources of vitamin K. How much of that have you had today? Interestingly, vitamin K has generally been considered to be important for blood clotting, but it is now clear that it has other major functions too, including bone formation. And I'm going to stop there because I have about 5 minutes left. And does anybody have any comments or questions before I stop recording? If you do, please just unmute